Hi everyone, I'm Cindy. Today we are going to talk about a disorder that you might have heard several times, which is Obsessive Compulsive Disorder, or we call it OCD. So, what is OCD? OCD is a specific type of disorder that is characterized by unwanted recurrent thoughts which become obsessions and are sometimes accompanied by repetitive actions which become compulsions. It is a condition in which sufferers take normal behaviors like washing hands and perform them compulsively. People with OCD often perform these compulsions and ritualistic behaviors to ease their intense and unbearable anxiety. It is often accompanied by the pervasive senses of fear, worry, and loss of control. A study suggested that in Malaysia, about 1 to 2% of the population suffers from OCD. Obsessions are the recurrent and intrusive thoughts that unwanted and cause a feeling of anxiety or disgust. It cannot be resolved by logic or reasoning. For example, unwanted thoughts can be the fear of contamination or the fear of losing something important. Usually, they lead to compulsions, which are the repetitive behaviors or mental acts that person feels driven to perform to try to reduce the anxiety caused by their obsessions. And these compulsions might be related or unrelated to their obsessions. For instance, they could wash their hands excessively, check the locks excessively, as well as pray excessively. In DSM-5, there are several criteria that need to be met for the diagnosis of OCD. First, they need to have the presence of obsessions, compulsions, or both. The obsessions and compulsions need to take a lot of time or cause significant distress in their social, work, or other important areas in their lives. Then, the disturbance is not better explained by symptoms of another mental disorder and not due to the direct physiological effects of a substance or general medical condition. In addition, there are also some specifiers in this diagnosis. Whether an individual has good, poor, absent insights or delusional beliefs towards their disorder, and whether it is TIC-related.
Hi, I'm Raymond, and let's move on to some experiential activities to better understand what exactly is OCD. I will now let you walk in the shoe of someone having OCD, where you will be able to listen to the obsessive thoughts in his mind and how he eases the obsessive thoughts with compulsive action. You are encouraged to put on your earphones for this part of the video as it will improve your overall experience for this activity. The following video clip will show how an OCD patient eases up the persistent fear of contamination in his mind with excessive hand washing.
Wash 3 times. I need to wash my hands now. I don't feel good. I need to wash my hands. Okay. I need to make sure that it's thoroughly clean. I don't want all the germs and the virus is on my hands. I think I need more soap. Let me wash again. Alright, wash again. I need to go through all of the tips of my finger, all parts of my hands. Okay, I think it's better now. Wait, let me just one more time. It doesn't feel right. I can feel something on my hands. I don't want the virus or the germs stay on my hands.
Now that you have experienced the obsessive thoughts that might appear in the mind of an OCD patient, the following activity will let you experience one of the compulsive behaviors shown among OCD patients. Now, imagine yourself as someone having an extreme fear of contamination, where you are really scared to be contaminated by people around you or the environment. In order to get rid of this persistent and distressing thought in your mind, you are now required to wash your hands thoroughly with soap. However, the whole hand washing process has to be repeated at least 3 times to show an excessive response to the fear of contamination. I will now show you a short demonstration clip, and you may pause this video to carry out this compulsive behavior. Welcome back. After trying out this compulsive behavior, I believe we should be able to step in the shoe of an OCD patient and understand these excessive actions and thoughts that seem normal to us could not be easily resolved through logic and reasoning. Welcome back. After trying out this compulsive behavior, I believe we should be able to step in the shoe of an OCD patient and understand these excessive actions and thoughts that seem normal to us could not be easily resolved through logic and reasoning in the case of an OCD patient.
After watching the video clip, you must be wondering why would people with OCD focus their anxiety on the occasional intrusive thought rather than on the possibility of a panic attack or some other external situation. One hypothesis stated that early experience taught them that some thoughts are dangerous and unacceptable because the terrible things they are thinking might happen and they will be responsible. This early experience will result in a specific psychological vulnerabilities to develop OCD. When people with OCD equate thoughts with a specific action or activity represented by the thoughts, this is called thought-action fusion. Thought-action fusion may in turn be caused by attitudes of excessive responsibility and resulting guilt developed during childhood. When even a bad thought is associated with evil intent. For example, if a thought randomly pops into your mind about something unacceptable, such as murdering your partner, you will be believing this to be just as bad as actually harming them. Thought-action fusion can also lead people to believe that thinking about an unwanted event makes it more likely that event will happen. For instance, you might think that by imagining a loved one dying in a car crash, it somehow increases the chances that this will actually happen in future. For more information, this is the diagram that illustrates the cognitive model of the cause of OCD based on the APA textbook.
I am Konyu. As we have presented what OCD is in psychological definition, now let's look at some common misconception of the public about OCD. You might hear from our friends saying that, "Oh, I like to organize things very well and I always plan things. I'm so OCD." Well, this is an example of the common misconception about OCD. Some individuals often think that organized behavior such as like to meticulously organize things or always planning out the weekend to the very last details are the symptoms of OCD. Also, people may think that OCD means that you only have the symptoms of keep washing your hands. So these are the misconceptions about OCD. This misconception sometimes might not harm anyone as is often seen as a joke between friends. However, our misunderstanding of individuals with OCD might become harmful. Some friends or family members around the individual with OCD might not aware that OCD is actually an anxiety disorder and do not know how much they might suffer from OCD. Instead, they might think that everyone has a little OCD. That's normal, right? And they just have to be more relaxed with OCD or just learn to live with it. So these are some common misunderstandings that do not help them much. In fact, individuals with OCD often need help from specialists. they might need to seek psychotherapy such as CBT, which include mindfulness-based cognitive therapy and acceptance commitment therapy. They also can seek for exposure and response prevention therapy. This psychotherapy often help them to reduce the symptoms of OCD. Besides, they may also need medication such as SSRIs or anxiolytics for their treatment. So, what do they need from society and family members? Study has shown that rejection, criticism, and anger towards individuals with OCD will lead to poorer outcomes of OCD. Meanwhile, social and family supports can help them to improve the well-being of themselves. They often need more understanding and encouragement from society and family members in going through this challenging period. Next, what we can do when we have a friend or family members with OCD. First, we can avoid giving suggestions such as telling them, just try not to think about your obsessive thoughts, which is not helpful at all for them. We can encourage them to seek support from specialists, help them to embrace uncertainty in life, and also educate ourselves about OCD to understand them more.
Hello, I'm Shutian. I guess you have roughly understood what OCD is. And in the previous slide, our presenter Marcus has talked about the misconception about OCD. What they really need is encouragement and understanding. Hence, our take-home message: let's put an end to stereotypes and help them to overcome OCD. We encourage the public to practice mindfulness. Mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. There are several studies found that mindfulness-based therapy helps in OCD symptoms like intrusive or obsessive thoughts, and it improves physical sensation as well as negative emotions such as stress and anxiety. Also, it has found to be a lower dropout rate in OCD treatment. This is because some patients develop stress and anxiety during the process of exposure-response prevention, and therefore wanted to stop for the next session. While mindfulness, which involves breathing techniques, have found to be beneficial in reducing stress, so nowadays, mindfulness has been integrated into interventional therapy. OCD have the main problem of acceptance, which is also one of the key features of mindfulness. Mindfulness encourages individuals to accept and move away from internal events without judging. Therefore, in mindfulness-based therapy, patients are usually asked to carefully observe their arising thoughts and label them as thoughts, feelings, or bodily experiences, instead of focusing on the content of thoughts. Mindfulness can be done anywhere. Here are some ways. 1. Focus on your 5 senses on the present moment. Another one, an anchor, a most common way to practice awareness and secure attention. You may try to be aware of your breathing. Feel the air entering and exiting your nostrils, or feel your lungs expanding when inhaling and contracting when exhaling. You may choose the way you prefer as long as you can stay focused. Feel free to try it out. So, in our take-home activity, we would like to suggest public to practice staying focused on breathing when you are standing, sitting, waiting for a bus or food serving. That's all for today. Thank you.